Thank you for listening to this brief webinar on engaging healthcare consumers on flu prevention. We hope that you will take away a better understanding of the importance of flu reminders, as well as some valuable insights on running an effective flu outreach. The flu costs the U.S. about $10.4 billion per year in doctor's appointments and hospitalizations for adults. Last year, 78% of PCPs saw an increase in appointments due to the flu. This was managed in part by redirecting to urgent care, extending clinic hours, utilizing telehealth, increased staffing, and redirection to the ER. Last year's flu season was categorized by the CDC as highly severe and sadly resulted in record level pediatric deaths. Through the years and our millions of interactions, we've learned a few things. The number one reason people report not getting the flu vaccine is because they say they don't get sick. In fact, about 60% of respondents said so. The second most reported reason people don't get vaccinated is concerns about the safety of the flu vaccine. Actually, this is the primary reason Spanish speakers say they don't get vaccinated, with 62% of Spanish speakers versus 47% of English speakers. Medicaid enrollees in general are also more likely to believe this than commercial or Medicare beneficiaries. Almost 40% of those asked believe that the vaccination shot causes the flu. Whatever the reason, it's important to debunk any myths and educate healthcare consumers on the best ways to keep themselves healthy during flu season. Eliza's flu prevention outreach is grounded in behavioral science, specifically the health belief model, which attempts to explain and predict health behaviors. In other words, by understanding someone's attitudes and beliefs, paired with factors such as demographics and prior knowledge, we can predict likelihood of completing a health behavior. In addition, several persuasive communication theories were included in the creation of Eliza's flu outreach. Most prominently, message framing theory was used because of its effectiveness for both preventive and screening behaviors. Framing theory suggests that messages can be framed as either gain framed or loss framed, and that way the message are framed can influence the choices an audience makes. Research shows that gain framed messages are more effective when used with a preventive behavior, like the flu vaccine. A gain framed message emphasizes what an individual would gain after completing a desired behavior. For example, a gain framed message about the flu could be, getting the flu shot today will keep you healthy all season long. When possible, it's important to segment audiences based on commonalities and tailor and target information appropriately. Eliza's flu outreach is segmented by age group, and the content is targeted to fit their unique differences and goals. During focus groups, the young adult and adult population discussed how ease and convenience are paramount when making a health decision. They're more likely to get the flu shot if they can get it in 5 minutes at their local pharmacy instead of making an appointment with their doctor. At Eliza, we never do one-for-one translation from English to Spanish. That doesn't work. We have a team of Spanish-speaking engagement designers who ensure that our Spanish outreaches are culturally appropriate and persuasive to their audience. Hispanics are a collectivist culture with strong family values, and we leverage that as much as we can. We always place an emphasis on family, whether it's on being healthy for their family or to protect their family. The other important piece is the words we use. In Spanish, there is no word for flu. In fact, many Latin American countries use the word influenza to describe the flu. If you have a cold, you say tengo gripe, but flu is oftentimes translated as gripe. To say flu vaccine, you would say vacuna contra la gripe, vaccine against the cold. This is incorrect. It certainly sounds less alarming than using influenza, but it may not be the best approach. Using the word gripe makes it sound like the flu isn't at all that bad. resulting in people opting out of vaccination. This is especially true among first-generation Hispanics from whom Spanish is their first language. For these reasons, we use the term gripe estacional, or seasonal flu. Eliza's flu immunization outreach takes a proactive, engaging, and measurably effective approach. Our multi-channel preventive health reminders is a quick and effective way to drive behavior and address barriers around the vaccination. Our interactive automated outreach lets clients quickly and cost effectively debunk some of those persistent myths about the flu shot. In one case, 46% of the people we asked believe the flu shot causes the flu. Point members to appropriate resources, whether it's their provider, a local drugstore, or an on-site flu clinic. Did you know that employers who provide flu shots increase the likelihood that someone will get their vaccination by 48%? Assess and address other barriers to getting the flu shot to boost outcomes. Clients running an Eliza outreach have reported increasing their flu shot rates by 34% over a control group. It's also a great end-of-year opportunity to engage with your members in relevant ways that drive loyalty and retention, such as adding it to an annual notice of change or renewal outreach. Our outreach does not take a clinical position in its messaging, but through brief and simple language, drives members to engage with healthcare providers and other clinical resources available to them. The automated phone, SMS, and email content is age-tailored with specific loss aversions and self-empowerment. Principles built into motivational language presented to each population segment, which aims to create awareness as well as share a sense of urgency and social norming for each cohort. Reporting and metrics are provided to clients throughout the campaign and include commitment to get the flu shot, and for individuals over 65, the pneumonia vaccination, perceived barriers and susceptibility, and awareness within the target population, measured by answering machine messages left, phone reach rates, and emails delivered. We can implement your flu outreach in as little as 4 to 6 weeks. To kick off your campaign, give us a call, shoot us an email, or visit us at elizacorp.com.